morning to the Chamber's October forthright luncheon. It's also the second annual Healthcare Professionals of the Year hosted by our Health Services Committee. I'm Ricky Krebs, the 2011 and 2012 Chamber Chair, and we all know that this part of the drill. If you will, at this time, take your electronic devices and cell phones and whatever else you have that might make a noise in the next hour, and turn it to silent mode, please. At our head table this morning, we have Jamie Medlock, a marketing representative with Hansville Nursing Home and Rehab Center, and the vice chair of the Chamber's Health Services Committee. And we have Lindsay Dawsey with CRMC. She is the public relations coordinator there, and she is the chair of our Chamber Health Services Committee. And on my left, Cheryl Bailey, who's vice president of patient care services at CRMC, and they're also our luncheon sponsor, and Dr. Don Williamson, Alabama's public health officer. At this time, I'd like to ask Jamie Medlock to come forward to provide our invocation and our pledge of allegiance. Jamie?
Will everyone please bow your heads? Dear Lord, we come to you today to thank you for this get-together and for all the wonderful health services professionals that we have that we're going to recognize today, and just bless our food to the nourishment of our bodies, and hope that we have a wonderful weekend. In Jesus' name we pray, amen. Amen. Everyone please stand for the Pledge of Allegiance. Attention, salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Jamie. And now I'd like to ask Cheryl Bailey, our sponsor our representative from CRMC and our sponsor of today's luncheon, to say a few comments. Cheryl.
Hello. Every day at the hospital, we strive to provide a safe environment for our patients, our visitors, our physicians, and our staff. So we are always looking for new processes, new products, whatever we can to offer to meet those goals. So I have 4 brief things I want to mention to you today that we're doing to help us meet the goals. The first is hand washing. Hand washing is the easiest way to prevent the spread of infection. But how do we really know how compliant our staff are? Where we are trialing a product on one of our nursing units, all down the hallways we have hand washing stations every few feet. These stations are also located in the patient rooms, and each of the staff members have a locator badge on. As they're walking down the hallway and into a patient room, the system picks them up. If they're in that room for longer than 20 seconds, the system knows that they are required to wash their hands. They can do that in the patient room or in the hallway, provided they wash it within 10 seconds. So if I'm the caregiver and I go up to that station, it'll say Cheryl Bailey 90% or Cheryl Bailey 20%. It lets me know immediately what my compliance is with hand washing. And it also provides information. It might be the director says we've got a staff meeting coming up. Or if I'm interested in college football scores, it may say college football scores, and it tells me what it is. So it's a great way to let me know as a staff member how I'm doing with hand compliance, and then also educating me on something fun. So that's something that we're trialing on one of our units. Next item is flu vaccines. Flu season is upon us. We have offered flu vaccines to our staff and our physicians for years, because that's something simple that we can do to help protect our patients. Well, this year we took it a step further, and we actually required all of our staff members to get the flu vaccine. Now, they can bring a physician excuse for a medical reason or a religious reason, but if they cannot take the flu vaccine, then they're required to wear a mask if they're within 6 feet of the patient. So you see all of our CRMC folks, we have a little green sticker. That lets everybody know that we have received our flu vaccination. And our physicians jumped on board too, and they're requiring it of themselves also. Third item, refresh your room. We've been at the hospital since 1995. And if you've been in our patient rooms, you've probably seen they're a little worn, okay? They're in need of a makeover. So our foundation will be starting a campaign for Refresh Your Room coming up soon, very similar to what we did with our ER campaign. So we're hoping folks in the community will contribute, maybe in honor or in memory of someone. And with that donation, what it will do is refresh the room. New bathroom, new paint, new floor, new bed. The beds that we have are beds. The new beds are smart beds. I mean, they have built-in technology to help protect our patients. Like for falls, the beds are lower to the ground. They have built-in bed alerts. We don't have to apply something. They also have built-in scales. That helps protect the patient because when you get them up to weigh them, they're at risk for falling. And that also puts our staff at risk for hurting their backs. So that's a new campaign that we're about to start. We're very excited about. And the last item is discharge teaching. If you've ever been a patient in the hospital or had a family member in the hospital, you know when you're being discharged, the nurse provides you with instructions, how you need to take your medicines, what you need to do when you get home. But how many times have you gotten home and you're like, now what did the nurse say about this medicine? Or I think they said this. No, they said this. Well, that puts the patient at risk for being readmitted because they were not able to follow their discharge teaching. So 2 weeks ago, we started a trial on our step-down unit. When the nurse goes into the room or the discharge planner goes into the room, they are actually recording the discharge instructions. And we give the patient a 1-800 number and a secure number, and they can call that number as often as they want to listen to those discharge instructions and hear any questions that were asked. So the goal is to give the patient the information that they need and to keep them well. So those are just a few of the safety things that we have in place. If you have any questions for me after our luncheon, I'll be here at the head table and welcome any of your questions. Thank you.
I've had young children, I think I'd like that monitoring thing of washing hands. But as an adult, I don't want a bed that tells me how much I weigh every morning. Sad enough, dude, when I stand on the scale once a week.
They'll tell you on the metric system.
Thanks, Cheryl, and thanks for CRMC sponsorship and also for everything that CRMC and the staff do for the chamber. This time we'll have our meal served. Please enjoy that, and we will resume our program just shortly. Thank you.
As Ricky Krebs mentioned earlier, I'm Lindsay Dawsey, and I'm the chair of the Chamber's Health Services Committee. Please continue to enjoy your meals. We have a lengthy program today, and we just want to go ahead and get started so we can get you out of here on time. The Chamber's Health Services Committee works to educate our community to make them healthier, to educate our businesses so that to create healthier workplaces. Each month we do a health focus of the month in the Chamber's newsletter, Dateline Coleman, just to help educate you and the members of your staff on healthy lifestyles. Something else that we have done last year when we did our inaugural event of the Healthcare Professional of the Year Awards, we produced and distributed the Healthy Lifestyle Calendar. And it was so well received, we were able to partner with CRMC's Nutrition and Wellness Services Department to offer this again, so that hopefully we can give you tips throughout the year to help keep you healthy. So please accept this from our group. On behalf of the committee, we're also extremely pleased that Dr. Donald Williamson, Alabama's Public Health Officer, could be with us today. The purpose of the Department of Public Health is to provide caring, high-quality, and professional services for the improvement and protection of the public's health through disease prevention and the assurance of services regardless of social circumstances or ability to pay. Dr. Donald Williamson was appointed State Health Officer and Director of the Alabama Department of Public Health in 1992, after serving as Director of the Bureau of Preventative Health Services from 1988 to 1992, and prior to that, as Director of the Division of Disease Control from 1986 to 1988. Prior to joining the Alabama Department of Public Health, Dr. Williamson served as State Tuberculosis Control Officer with the State of Mississippi Department of Health. Dr. Williamson received his medical degree cum laude from the University of Mississippi School of Medicine in 1979. He completed a residency in internal medicine at the University of Virginia in 1982 and is board certified in internal medicine. Please help me give a warm Coleman welcome to Dr. Williamson.
Thank you. It is a privilege to be here. My goal is to make sure I finish on time. I was thinking as I was eating a portion of the orange roll, which I have been assured had all the calories removed, that it probably was not helpful for what I want to talk about. What I really want to focus on today is something that struck me personally about 2 months ago. Now, I have been blessed with generally good health. I never go to the ER, but I ended up in the emergency room a couple of months ago and ended up getting 4 MRIs, a CAT scan, and a host of other tests, and I got the bill back. And the bill was like $22,000 or whatever, and the insurance paid all but 100 or so of it. And so I'm feeling fortunate, but it struck me as I was thinking about that, what are the drivers of healthcare costs? I mean, our legislators are dealing with how in the world do we pay for the healthcare for state employees and teachers. Businesses are struggling with the challenge of how do you pay for the health care for your employees. Hospitals are dealing with extremely tight margins. Nursing homes are dealing with, is Medicaid going to go broke? These are the times in which we live. And after doing some thinking and doing a little research, it struck me that I really can put the drivers for healthcare costs into three groups. And only one of those can we do anything about. The three are technology. I had 4 MRIs. 20 years ago, I would have had no MRIs. It would have been a lot cheaper. How much technology do we need? Well, it depends. Are we talking about my coronaries who need to be opened or yours? From the perspective of the individual, you cannot spend too much money on health care. From the perspective of society, that's a different argument. But in this country, we have not taken the position they have in the EU and in other places where we're going to set certain parameters beyond which we will not go. In other words, we're not going to say, we're not going to do a kidney transplant on you if you're over 60. We're going to force you to go to dialysis. We haven't said that if you have pancreatic cancer and need a liver transplant, if we can work it out, we're not going to give you a liver transplant. We're much more willing to spend dollars on technology. And frankly, every one of us want better drugs, better health care. We want the least invasive procedure possible to return us to the best health. So technology is a driver. Unless we change the fundamental ethics of our healthcare system, that's not going to go away. In fact, it's only going to get worse, because healthcare is very much like the old movie, Field of Dreams. If you build it, they will come. If you put an MRI scanner in a hospital, it will be used. If you suddenly have 14 cardiologists on your staff, you will build a cath lab. If you have a cath lab, they will use it. That's not because doctors are evil or healthcare facilities are evil. It's because with capacity and with new interventions, we find better ways of diagnosing and treating diseases and managing health. So technology is a fundamental driver. We can't undo that. The second driver, we don't want to undo. It's the aging of the population. I'm a baby boomer. Many of you in here are baby boomers. We are, if you think of the demographic, if you think of the population of America as a python, as a long, smooth snake, we are the pig in the python. We're the hump. There are fewer in front and there are fewer behind. I know that just think about that for a little while.
Thank you very much.
You're welcome. I'm grateful that I can help your lunch. If you can't have fun talking about unpleasant topics, why do it? But the point is, Number one, the baby boomers hit Medicare for the first time this year. Or actually last year, in 2010. We will now drive the demographics of healthcare for the next 30 years. Think about what that means. That means that right now, we don't have enough healthcare providers. 30 years from now, we absolutely won't have enough healthcare providers because we're going to have 3 times as many people over the age of 80 as we do now. We don't have enough, do we have enough hospital beds? Probably. Will we have it as we age? Probably not. Do we have enough nursing home beds now? Maybe. Will we, if we're going to take care of the elderly in the same way we do now? No. Can we afford the Medicaid system we have now? No. We certainly can't afford the Medicaid system, or the Medicare system for that matter, with the aging of the baby boomers. And the problem, of course, is we spend most of our health care dollars as we approach the end of life. And of course, the ending of life tends to be associated with an aging of the population. So the baby boomers moving through fundamentally alters what we have to deal with in terms of healthcare cost, healthcare demand. And it's not just that. Baby boomers are different. Those of you who are baby boomers, you probably had parents like mine. They grew up in the Great Depression. They were products of a different era. My dad's 82 or 3 now. And he looks at life fundamentally different. For example, Sunday morning, church is out. People are crowding the aisles, talking, blocking the aisles. My dad thinks that's perfectly acceptable. I think an electric cattle prod would clear the aisle. You're in Walmart, and you're in the 20 items or less. My dad, if they've got 82 items in the cart, he feels sorry for them because they can't add. I think there's a special place in hell for them. We are just fundamentally different. Baby boomers were the first generation to be taught. Incorrectly, it turned out. But our parents sort of made us feel we could do no wrong. And we had expectations very, very different than our parents. Well, unfortunately, we've carried those expectations forward. And not only is it going to be the phenomena of the aging of the population, it's going to be the expectation that population carries to its healthcare system. Use my dad again. He just moved to North Mississippi, and it took me about 2 months to get him into an intern. And I called him. I said, "Dad, I'll be glad to call him, and we'll get you in sooner." He said, "No. If it's not convenient for the doctor, I don't want to do that." Now, that's not in my vocabulary. But he was perfectly okay. That's the problem. Patients are going to carry the expectations that they had as adults into their senior years, and that's going to fundamentally deform their expectations about the health care they're going to get, about when they're going to get it, and about how they're going to get it. So 2 things in this triumvirate we don't control: aging and technology. The third one we better control, and that's lifestyle choices. And now I've gone to meddling. There are fundamentally 2 that if we could fix, we can reduce death rates, and more importantly, we can keep people healthier longer. Tobacco and obesity. Now I can do the easy one first, or I can meddle first. Let me do the easy one first. Tobacco is the single leading cause of death, preventable death in the United States. It's the single leading cause of preventable death in Alabama. Over 8,000 people a year die from tobacco. About 800 a year die from secondhand tobacco exposure. I always assumed, it's amazing what you don't know that you don't know. I pretty much always assumed that the major cause of death from secondhand tobacco smoke was in fact lung disease. because it's the primary cause of death for smoking yourself. Turns out that's wrong. 70% of all secondhand tobacco-related deaths are due to cardiovascular disease. And if you look at studies done in the United States and look at communities where they changed their indoor clean air laws and looked at hospitalizations for heart disease, there is on average, this is from the Institute of Medicine, there's a 14% decline in heart disease and heart attack death rates in the first year. Now, why is that a big deal? Well, it's a big deal because Alabama we rank 45th in the country in the percentage of tobacco use. Now, has it gotten better? Absolutely. You know, we used to be probably at 40%. Today we're at 22% of adults smoke, which is unfortunately too high. The one that really troubles me is that 18% of 9th to 12th graders smoked in the last month. None of those kids can legally buy tobacco in Alabama, which is a fundamental problem. You know the data. If you don't start smoking by the time you're going to graduate from high school, you never will. I mean, that's just a truism. What do we do about this? Well, there are a lot of things that work. Tobacco we understand probably better than any other single intervention in public health. The two most important ones are an indoor clean air bill and a tobacco tax. Let me tell you why an indoor clean air bill works. An indoor clean air bill works because it does two things. Number one, it protects the non-smoker. Now, don't get me wrong, I'm not really worried about the patron who goes into the restaurant and the restaurant smoking. I mean, I worry about them, but that's not my driver. They have a choice about whether they're going to work there or not. Excuse me, whether they're going to eat there or not. My major concern is for the worker, because in this economy with 10% unemployment, there really aren't lots of other jobs. And pretty consistently across the country, when you look at studies and you look at what happens to the illness rate of waiters and bartenders in restaurants when they go from smoking to non-smoking, there's this huge dramatic decline in health costs in the wait staff, in the people who work in the restaurant. So the first thing is you have a huge effect on people who are working who have no way to avoid the secondhand smoke. It also, the data around the country shows that if a restaurant goes smoke-free, its business actually increases, it doesn't decrease. The other major issue around a strong indoor clean air bill, I'm just going to be honest, it is a disincentive. If you have to go stand outside in the rain and smoke, some people will stop smoking. In fact, a strong indoor clean air bill will reduce tobacco consumption by about 5%. That's not insubstantial. So that's important. But the single best way to reduce tobacco consumption is a tobacco tax. Alabama's tobacco tax is 42.5 cents a pack. We rank 47th in the country. We can raise our tobacco tax by $1 a pack, and we're still below the national average. The national average is $1.45 a pack. Plus, it raises, by the way, $213 million a year for the general fund. But the reality is, a tobacco tax reduces tobacco consumption overall by about 5% and reduces tobacco consumption among young people by up to 7% because they have the least disposable income. A $1 a pack increase in tobacco tax would have an effect of reducing tobacco consumption in the state by about 10%. Add that with a strong indoor clean air bill, and you'll have a 15% decline in tobacco consumption. And what that kind of change moves Alabama from being among the worst in the country to, at the very least, being in the middle of the pack. That is the single most important thing we could do to change lifestyles, to reduce healthcare costs over the long term. The next big thing we could do, we don't know how to do as well, and that's to deal with obesity. Let me start with the assessment. that all of us are responsible for the choices we make about eating the orange roll. And I hate that. I would like to blame someone else, but I can't. We're all, so I only ate half of mine and prayed over the other half. Anyway, but we're all responsible for that decision. But the reality is, most of the decisions in life we make and most of the choices we make in life, we require societal reinforcement to get us to make the right decision. Let me just use a couple of examples. The speed limit's 70 on the interstate. My car has 160 on the speedometer. Now, would they really have put 160 on the speedometer if it wouldn't do 160? I don't know, I haven't tried that yet. But I guarantee you'll hit triple figures. So why don't I drive at 120 miles an hour down the road? Because there are these other people with blue lights on their cars and radar guns that will give me tickets. So we've used society's mores, in this case, to control a behavior, to reinforce a behavior we want. A different one. I own a house. Many of you in here own houses. If the tax policy of the United States were not that I could deduct the interest on my house, I would not own a house, because to me a house is nothing other than a place to pour money into a black hole. But we decided as a country that home ownership built more stable communities. And therefore we use the tax code to incentivize a behavior that we want. Okay, how can we construct as a society a healthy, low-fat, non-obese society? Well, I don't have all the answers, but these are some of the things that we are right now in obesity where we were 25 years ago with tobacco. We are just beginning to understand the things that work and the things that don't work. The first challenge is the healthiest foods are not the most inexpensive foods. In fact, the healthiest foods are often the most expensive foods. Foods like bananas, high in potassium, far more expensive than a Snicker bar. Broccoli is more expensive than rolls. So the first challenge we have to look at is, how do we help people when they're economically challenged to make healthy food choices? You know, again, I'm not going to advocate a fat tax, which is basically what they did in New York City, and I don't think you can ban trans fats in Alabama. But we need to figure out ways to incentivize people using farmers markets. We need to figure out ways to make those food choices no more expensive than unhealthy choices. So an idea that I've talked with several legislators about is the idea of, let's take the sales tax off of unhealthy food. So let's take the sales tax off healthy foods, leaving it on unhealthy foods. Or if nothing else, take them off vegetables at farmers markets. And what you've just done, you haven't raised anybody's taxes, but what you've done is you have just offset and basically made the two more price compatible. You know, we've made real progress in school lunches. Today in Alabama, I never thought I'd live to see this, you cannot spend state money to buy a deep fat fryer. I didn't think that would ever happen, but you can't do that. And if you look at the vending machines in school lunches, in schools, they are substantially healthier than they were a decade ago. Government can function as you have to build new streets, by doing something called complete streets, where you also build, if you've been to Colorado or even to Pensacola, you see there are bike lanes on the sides. Encouraging people to ride their bike and not be run over by the 18-wheeler. There was a wonderful study, I'm sure we paid millions of dollars for. It was published in the New England Journal years ago from the Northeast, and it showed that if you're in a neighborhood with sidewalks, people will use them more and will exercise more. Stunning development. The problem was that study was done in upper middle class neighborhoods where crime was very low. And I don't know about Coleman, but I can tell you in Montgomery and Birmingham, you can build all the sidewalks you want to in certain parts of the city, and nobody's going to walk on them because they're not safe. So there is a commitment when you're going to do this that you also provide the infrastructure in terms of police protection, in terms of lighting, so that people will actually use the sidewalks. As you're planning neighborhoods, turns out cul-de-sacs are terrible for people to walk and for people to bicycle. What you want is you want a subdivision that has streets that go continually in those cul-de-sacs, and instead of having all of the shops, etc., outside the subdivision, you want a center inside the subdivision where your shops and your stores are, so that people can ride their bikes or walk to those. All of that facilitates increased mobility. The last thing in closing, at the end of the day, most of us are driven by our wallets. At the state level, we have begun to use, the legislature and the State Employees Insurance Board have begun to use the power of the purse to drive behavior. Beginning about 3 years ago, state employees actually had to submit to a series of tests to look at blood sugar, to look at blood pressure, to look at cholesterol, and if they were outside some very generous parameters, they had to go see their physician. If they didn't get screened, or if they didn't go to their physician, they ended up having to pay $25 more a month. That's the model that ultimately will result in a behavior change. When we begin to risk rate health insurance, so that if I choose to eat that orange roll and have a BMI of 37 or 40 and don't do anything to sort of fix that, then I'm going to pay more than the person with great willpower who didn't eat the orange roll, who has a BMI of 24, who runs 3 miles every morning, whose blood pressure is normal, whose blood sugar is normal. That's how we're ultimately going to get a behavior change. And let me tell you in closing why that's so important. My son is 28. He doesn't have any children yet. Hopefully he'll figure out what causes them eventually, and he'll have a grandchild. But the challenge for me, the challenge for many of you is our children and grandchildren's generation will be the first generation in the history of the United States that has a shorter life expectancy than we do. And that's for no other reason than obesity. Today, 1 out of 10 Alabamians are diabetic. The current projections done by the Centers for Disease Control are that for children born in 2003 and after, 1 out of 3 will be diabetic in their lifetime. That's the function of obesity. Either we will change behavior or we will bury children. Thanks very much.
Thank you for all that you do with us today. The Chamber's Health Services Committee is happy to be hosting our second annual Healthcare Professional of the Year program to recognize the wonderful healthcare professionals in our community that go above and beyond the call of duty. Recipients of this year's recognition can stand out for their diligence, their dedication, their leadership, their outcomes, and overall provision of patient care. This year's 2011 and 2012 Healthcare Professional of the Year recipients all do that. We could spend an entire day reading out all of their accomplishments because each of them has many, many, many. So I'm just going to share a few of the comments that we received on the nomination forms for each of this year's recipients. Our first recipient is Ann Armstrong, a nurse practitioner with Coleman Internal Medicine. In the comments provided on her nomination form, some of the comments we received were these. Ann's knowledge of current research aids greatly in explaining to patients the most beneficial treatment plan. She is an active member in the community, and her friendliness brightens anyone's day with her wonderful sense of humor. Ann? Our next recipient is Belinda Cornelius, Administrator for Coleman Dermatology Clinic, in the category of Medical Group Management. Comments shared on her nomination form include, Belinda has focused her career on making the healthcare community more accessible and more efficient for those that need it. She has been consistent with her ongoing commitment to staying ahead of the learning curve, bringing every talent and nugget of knowledge she has learned back to Coleman. Belinda, I don't think she's here today. I don't think she was able to join us. In the category of licensed practical nurse, we have Charlene Guest with Hansville Nursing Home and Rehabilitation Center. Comments shared on her behalf, Ms. Guest is truly a remarkable and beloved employee. She has been dedicated to this facility for 43 years. She makes a difference every day. Charlene exemplifies all of the positive qualities necessary to be an LPN. She has exceptional resident-family communication skills. In the category of Nursing Service Department Director, I'm proud to announce Cindy Hawkins with Coleman Regional Medical Center Emergency Services. Cindy is continually giving back to this community by advancing her knowledge base for the benefit of patients in our community. Cindy was present throughout the process of the ER renovation. This renovation process was a success under her direction and coordination of multiple phases during the construction. The success of our community ER has been achieved under the great leadership provided by Cindy Hawkins. Our next Healthcare Professional of the Year is Dr. Neil Shamban of CRMC's Emergency Services Center and Pegasus Emergency Group in the category of Physician Emergency Medicine. Having a double board-certified physician in pediatrics and adult emergency medicine is rare to find at a regional medical center. Dr. Shamban's passion for improving patient care makes him an exceptional healthcare leader in our community. Dr. Shamban has improved the Emergency Services Department's patient satisfaction levels to the highest levels in the past decade. He has raised the bar for all other emergency departments in the state for quality outcomes and patient satisfaction. Dr. Shamban. Our next recipient in the category of Registered Nurse, Skilled Nursing Facility is Cynthia Renee Standridge with Hansville Nursing Home and Rehabilitation Center. Ms. Standridge has always takes it upon herself to lead with great skill and dependability. She truly makes a difference in our facility and in the lives of the residents we care for. She is an outstanding leader and demonstrates the value we stand for in her everyday work. Her hard work and attention to detail improves our team and shapes our future. Ms. Our next recipient is Kevin Taylor, a respiratory therapist at Coleman Regional Medical Center. While the community was in turmoil from the April 27th tornadoes, Kevin was doing all he could. With the power being out throughout the community, people on oxygen were in need. Kevin is always there to help out. His willingness to be there for the community during hard times makes him a special nominee. Kevin. And our final 2011 recipient is a little different than the others because it's not an individual, but rather a group. On behalf of the Health Services Committee, it's my pleasure to recognize the Coleman Emergency Medical Services Ambulance Service. Their efforts during the first few minutes in an emergency situation are critical. Their commitment to serving Coleman County since 1970 is unparalleled. Let me ask Jerry Sellers, the EMS Director, to come forward and accept this recognition on their behalf. I just want to give a few comments from their nomination. CEMS was the first EMS agency in the state to have all ambulances outfitted with CPAP. First EMS in the state to implement a hypothermia protocol for cardiac arrest survivors. The only EMS agency in the country with a medical director double board certified in critical care medicine and disaster medicine. CEMS also, on the day of April the 27th, that no one in our community will forget, took a direct hit to their facility. During that time, they did not miss one 911 call and kept their units on the road to help the citizens of our community. So that alone, I think, deserves another round of applause. Congratulations on behalf of the Chamber's Health Services Committee. Congratulations to all of this year's recipients. Thank you for all that you do for our community, and we hope that you continue to do your best and continue in this manner. Thank you so much.
Thank you, Lindsay, and again, congratulations to all our winners. And Lindsay, thank you and CRMC for everything that y'all do for the Chamber and all the great services by the Health Services Committee. At this time, we'd like to recognize a few folks that are attending their first Fourth Friday. As I call your names, if you will, please stand. Christy and Wynn Williams with Alabama Therapeutic Massage. Sandy Seibert with B-Trim with Sandy. And Tammy Harmon with Isogenics. We're so glad that you decided to join the Chamber. I encourage you to get involved with the Chamber, and the best way that I know to do that is to get involved with the Chamber Committee. Because you see it on the Chamber committees, all the things that happen behind the scenes that make things happen in the Coleman community, and I think you'll find that way that you will get the best advantage of your membership. Our door prizes today are courtesy of our sponsor CRMC, and I'd like to ask Cheryl Bailey to come back to have some drawings of that.
We have 3 drawings.